Hello, welcome to IPHS 403, Public Health Systems, Policy and Management. In Module 6, we'll talk about workplace management, and Week A will focus on human resource management and the case studies. The learning objectives for this module will be focused on understanding the public health workforce, identifying leadership styles and practices, so that you will be able to develop your own style and be able to recognize different leadership styles. And we'll also talk about human resource management and strategic management of human resources. When you run an organization, especially in public health, you want to utilize the strengths, the expertise, and the talents of your employees and your volunteers and the constituents in your community. Here, in this example, given the current professional labor market, generational differences, rates of retirement, design a strategy for recruitment, selection, orientation, development, and retention of high-performing professional workforce for a large public health organization. As you can see, one of the key factors in developing a workforce that's effective is the recruitment. Recruiting the right people who are doing the right things and who are also passionate about your organizational mission. In the other exercise, you are given an opportunity to prepare a budget and staffing reduction plan for your public health organization. Analyze the revenue, expenditure, components of the organizational budget, and the implication of various options for budget cuts. This is a very important skill set to have, especially when you're working in a nonprofit organization. You need to be savvy in the ways to utilize the funds in the most efficient way. And unfortunately, there will be a time when there's going to be budget cuts. So by understanding what goes into the budget, you, as one of the employees of a nonprofit organization, can offer suggestions. Rather than having one of your co-workers being laid off, maybe there's strategies that you can see within your organization that funds are being used very ineffectively and inefficiently. There are 7 components of the public health workforce. This diagram illustrates relationships and key aspects of the public health workforce based on workers' skills, work settings, and content of work. You can see that there are areas where they overlapped and areas where it's very distinctive in this particular arena. The 3 circles indicate public health work settings, public health trained, and public health work. So you can see that these circles can overlap and there's different components that describe the workforce. So for example, someone could be not trained and don't do public health work in a public health organization. So who will be those individuals? What about those that are not trained but they do public health work in a public health organization? What about individuals who are trained, do public health work, and are in a public health organization? You can see that there's so many different makeups in an organization, and that you want to utilize the skills, the expertise, and talents of your workforce. In this case study, making cuts in the state health department budget, you're going to examine a budget and to see how different areas of an organization operational plan is allocated. And in this example, when there is a cut, where there's a 50% budget cut, where are the funds being reallocated or eliminated or reduced? And what are areas where budgets are increased? So these are things to think about when you look at the budget. And in this particular case, we want to examine what would make the health organization function better and more efficient under these circumstances. I know budget cuts is a sensitive issue for many people and many organizations because the first thing that comes up to people's mind is job loss or layoff, right? Rather than they're going to decrease the office supplies. This is where human resource management becomes a critical component in the decision making. And I know a lot of individuals might think that, oh, HR, like what do they do? Well, this is where they play a critical role because they can emphasize what activities needs to be maintained, needs to have additional support, and what are some activities that could be reduced given this challenging economic circumstances now. These are the areas that the human resource management looks over, such as the leadership, organizational structure, contractors, recruitment, job description, professional development, training, performance support, and any type of negotiation with unions. In addition to understanding the human resource management is to also look at a systems level approach of thinking about the organization. Here you see in this diagram that it encompasses the assurance, the assessments, and the policy development of how the system is working in your organization. So what would be those different factors? Well, for example, you need a group to evaluate. You need another group to maybe link individuals such as patients to medical care. Now, given all the crisis that's happening around us, especially infectious diseases that are emerging, chronic diseases that need to be better managed, the public health workforce is actually decreasing over time. So why is that? Even though there's an increased demand to address the public health challenge. So let's examine where public health workforce lie. Well, they could be working at the emergency medical services, medical health, outpatient clinics. They can also be serving as nurses, also in animal control, pollution control. So the public health workforce, expands beyond just the public health department. So as you can see, public health is everywhere. Therefore, human resource management in public health is very unique. It plans for and recruits the correct number of individuals with the right skills, with the right knowledge, and the right work ethics to work in areas where they're working with individuals and communities, especially to improve the health status of populations, vulnerable populations, and communities that maybe are not as open to speaking out loud. So they also need to have they also need to be a people person too. In our previous module, we talked about management from high level, right? So there's the organizational mission, visions, and values, and there's a strategic plan and strategies. So where does human resource management fit in? Well, it actually fits in between the strategic plan and the execution, because you need to find the right people with the right resources to carry out these activities. So that's why human resource management is very uniquely positioned in an organization, because you could have the right task, but if you have the wrong people doing the right task without the right motivation, you will never see an end product. And if you have the right people with the right talents, but you assign them to tasks that doesn't really utilize their skills, then it's a very ineffective way, an inefficient way of using your funds. I know, you're probably thinking, I don't visit the HR department, and the last time I visited there was probably when you were hired, right? Well, as you can see now, the HR activities happen throughout the organization. There's the workforce planning, the job analysis, the recruitment, the motivation, the training, and the coaching, and the promotion. And then, and this cycle continues on because, once you're in an organization, maybe you want to move up the ladder, or maybe you want to move across different units. All of these activities takes place and are managed by the HR department. So in this circle of activities, we're just going to focus on the workforce planning. In the workforce planning activities, you're projecting a number by asking these questions. What are our needs? Who's retiring? When? How many of which discipline? And how much would they cost? Do you remember your toolkit? Well, this is where an opportunity where you can revisit the professional transition agenda, the public health logic model, the public health infrastructure, scorecard, and the community health assessment strategies. All of this information will help inform your decision making and the workforce planning. In the recruitment and selection phase, it would depend on the salary, the supply of workers, the strength of the individual, the reputation of the organization, the morale of the current workers, and are you recruiting skills, new skills, or are you replacing someone with the similar skills? So let's visit back the case study, making cuts in a state health department budget. In this case study, we're going to focus on the least harm decision making and see the summary of the cuts by units, which is listed in the Blackboard site. And in this module, you're going to incorporate an ethical analysis and the decision framework from week 3. And the ethical issues involved in both the content and the process for budget reduction is very important in health and human resource management. So let's revisit the public health practice ethical principles. In the Blackboard side, the detailed information about the budget cut, the saving, and the impact is listed in detail for each different items. The slides here are going to highlight at a high level what these are, but the interpretations are actually listed in the Blackboard site. So for example, here, the Center for Children and Family Health, right? The budget is $11,280,000. With a 15% cut, that would be $1,692,000. So let's think about where would be areas in the organization, specifically in this unit, that would be missing, right? Would it be personnel? Would it be programs? Would it be treatment? Or would it be educational resources? These are things to think about. So for example, these would be the administration and program services, right? So in this case, you're reducing about $1 million, and where would that extra money go to? Now, for example, here, the idea is that it would eliminate the team health information line. It would eliminate 4 high school-based clinics, reduce support for prenatal clinic services, and abolish state funding portions of the children's health program. But it also lists the savings for each of these budget cuts in these different areas. So if you're working in the area of finance, financial management or human resource management, you're in a very sensitive position, right? Because you want to support the programs that are, support programs that have a high return on investments, and oftentimes you're going to be making these very difficult decisions because you're going to have to cut some programs. But if you're able to show the cost savings, and that perhaps these programs were, maybe in theory they have, in theory they want to produce high benefits, but in reality they just had a very low return on investment. And that may be because the execution of the program, or maybe the community wasn't taking advantage of these programs, so that's why you didn't see a high benefit. And so it's not to say to eliminate the cause. Maybe it's the cause for this particular program is worthy, but you need to think more, you need to be more innovative in the way you think about how to apply these funds to support programs that are going to be both effective and efficient. And here's an example of what would be eliminated if we were to cut some portion of the disease prevention and epidemiology, but there's also cost savings to this. And how would it affect environmental health? Or in this case, it would eliminate staff in a particular office. It would initiate fees for public drinking water systems. So, maybe that's another way to generate revenue, in this particular state where there's a budget cut. In the area of public health laboratory, maybe it would eliminate free parasite testing and also other type of STD testing, or perhaps giving flu shots or other types of benefits for the public. So in summary, these are the proposed cuts. In total, it would be $4,556,000. I know that's a lot of money, right? But when you revisit the slides and the description of each of the areas that are being cut, you can't help to wonder that, if there was enough money, wouldn't you would love to fund all of them or keep them all going because they all have worthy causes and they all make some type of impact. But unfortunately, we don't live in a world where there's puddles and fountains of resources. So we need to be very strategic in the way we are allocating our funds. To make these budget cut decisions, it is important to have a framework in mind so that it makes the decision making a little bit more easier. So things to think about, right, is the population factor, the agency missions, and the ethical and moral factors. And by considering these specific factors, you can see that, okay, well, we have this worthy program, but it's really targeted into a really specific group and it's missing out, this huge other population. So maybe we should reallocate funds that supports the majority of the population, right? As opposed to this really small group of folks. The other thing to think about was the moral factor, between what's right and wrong. In this scenario, the different groups will assess these ethical issues as they're considering the budget cuts. In the next series of slides, there's a list of questions. So instead of having me read out the questions, I'm just going to leave the slides on a little longer so you can look at them. And also, I'm going to keep the ethical and moral considerations guidelines longer so you can also look at that and jot down information. And you can also revisit the questions again. And also ways to examine conditions that's going to help your decision making as it pertains to the budget cut.